Sense of urgency ini telah pun kita melihat melalui penubuhan Greater Klang Valley Task Force yang telah dipengerusikan oleh Dr. Chong pada bulan PAS. Dan kita akan membawa fokus dan intensiti yang sama kepada beberapa negeri yang sedang berhadapan dengan penularan kes yang tinggi. Antara negeri yang akan kita memberi fokus dalam beberapa hari dan minggu yang akan datang adalah negeri Sabah, negeri Johor, negeri Kedah, negeri Pulau Pinang dan juga negeri Kelantan. Negeri-negeri tersebut bukan hanya akan menerima bekalan vaksin yang lebih, tetapi juga kita telah memulakan proses pemindahan tenaga kerja dan juga aset-aset perubatan kepada negeri-negeri tersebut daripada negeri-negeri yang tidak lagi memerlukan aset dan juga tenaga kerja berlebihan. Ini adalah usaha untuk kita memastikan bahawa kes harian dan juga bilangan penduduk Malaysia yang terpaksa dimasukkan ke hospital ataupun mengalami gejala yang serius dan teruk daripada COVID-19 dan juga kes kematian dapat kita kurangkan di negeri-negeri tersebut dan secara keseluruhannya untuk seluruh negara Malaysia. Selain daripada itu, saya telah buat ketetapan untuk meningkatkan lagi ketelusan Kementerian Kesihatan Malaysia dengan pemberian data dan maklumat tambahan kepada orang ramai. Kita akan mula keluarkan pelbagai data secara terperinci bermula minggu hadapan. Dan ini adalah granular data yang akan kita sediakan secara terbuka kepada semua untuk melihat lebih daripada data-data yang telah pun kita bekalkan selama ini. Saya ucapkan tahniah kepada pengurusan KKM sebelum ini dan juga kepada Tan Sri KP kerana banyak data sudah pun mula disenaraikan secara open source di GitHub. Tapi saya telah buat ketetapan bahawa budaya kerja KKM selepas ini lebih kepada ketelusan supaya soal kepercayaan kepada kerajaan dan respon KKM kepada pandemik ini tidak lagi ada tuduhan kerahsiaan ataupun tidak lagi ada tuduhan tembok maklumat yang tidak dapat kita perolehi daripada kerajaan. Yang ketiga, ketetapan yang telah pun kita buat adalah usaha untuk kita menerima bahawa COVID-19 ini adalah endemik. Maksudnya kita akan terima hakikat bahawa sekalipun kita berjaya insya-Allah mengawal pandemik ini dari segi kes jangkitan, dari segi kes kematian, dari segi kes kemasukan ke hospital, kita juga perlu bersedia menerima hakikat bahawa COVID-19 ini akan menjadi endemik dan kita hidup bersama dengan virus ini. Ini adalah konsisten dengan pendekatan negara-negara lain di mana kebanyakan negara sekarang ini sudah pun beralih daripada total containment kepada fasa endemik di mana satu norma baru diperkenalkan untuk kita hidup secara sehat dan selamat walaupun virus ini masih lagi berada di kalangan kita. Dengan adanya vaksinasi, usaha untuk mengadakan perubahan tingkah laku ataupun behavioral change dan usaha untuk mengamalkan SOP berterusan, kita boleh masuk fasa baru iaitu fasa endemik COVID-19. Langkah ini akan membolehkan pelbagai sektor dalam negara dibuka dan kehidupan kita kembali berfungsi seperti sedia kala dalam norma yang baharu. Sukacita saya umumkan bahawa kerajaan akan mengumumkan beberapa langkah untuk memudahkan SOP yang sedia ada supaya tidak terlalu banyak, tidak terlalu rumit, tidak terlalu complicated, supaya apabila kita masuk dalam fasa endemik nanti kita ada senarai SOP yang jelas, yang mudah difahami dan yang akan sama-sama dapat kita mempraktikkan. Sebagai persediaan untuk hidup bersama COVID-19 dalam fasa endemik, tindakan-tindakan berikut perlu dilakukan oleh seluruh masyarakat. Yang pertamanya adalah untuk mengamalkan norma baru dari segi SOP yang akan dimudahkan nanti. Yang kedua, mask mandate itu akan diteruskan. KKM masih lagi tidak ada apa-apa perancangan untuk melonggarkan mask mandate kita ataupun keperluan untuk memakai pelitup muka. Kita sudah melihat pengalaman di negara-negara lain di mana mereka telah melonggarkan mask mandate mereka. Dengan adanya penularan varian-varian baru, mereka terpaksa memperkenalkan semula mask mandate mereka. Jadi di Malaysia, kita akan mengamalkan pendekatan yang berhati-hati dan kita akan kekal dengan pemakaian pelitup muka. Kita akan terus dengan usaha di bawah program imunisasi kita untuk memastikan bahawa seramai mungkin penduduk di Malaysia menerima vaksin dan dilindungi melalui imunisasi. Kita juga akan mengamalkan kuarantin kendiri di rumah dengan penuh tanggungjawab. Sekiranya telah dikenal pasti di aplikasi MySejahtera sebagai kontak rapat, contact casual, person under surveillance ataupun suspected atau confirmed cases. Setelah menjalani ujian saringan COVID-19 dengan keputusan ujian diketahui, telah dikenal pasti sebagai kontak rapat dan masih menunggu panggilan daripada pejabat kesihatan daerah, dan sekiranya dikesan positif COVID-19 dan sedang menunggu panggilan PKD, kekal di rumah melainkan memerlukan rawatan perubatan kecemasan. Apabila kita beralih kepada fasa endemik ini, sangat penting untuk kita mengambil tanggungjawab kendiri ke atas kuarantin kita di rumah. Kalau sekiranya kita tidak dapat mematuhi segala syarat untuk kuarantin di rumah dan juga kawalan kendiri, kita tidak akan dapat hidup bersama dengan virus ini dengan selamat. Sebab itu kita akan tekankan self-responsibility for home quarantine. Kita juga seperti mana yang sedia maklum, ada banyak pendapat dan pandangan yang mungkin tidak mencerminkan realiti di lapangan. Ada yang menyatakan sekarang ini semua yang kembali ke Malaysia atau masuk ke Malaysia dapat melaksanakan kuarantin rumah. Ya? Ini tidak betul. Ini tidak betul. Sejak 10 hari bulan 8, 20,000 orang yang masuk ke Malaysia telah mohon untuk home quarantine. We do not give home quarantine to everyone who comes back to Malaysia who are fully vaccinated. No. 10,000, we have received 20,000 applications. Yang kita telah lulus adalah 4,159 sahaja. And this is based on strict risk assessment. Risk assessment of whether they are vaccinated, their test history, also where they come from, and also keadaan rumah mereka. Jadi dalam hal ini kita masih lagi ketat, mana the default is still quarantine at the quarantine center. You still have to request for home quarantine. Saya juga suka cerita maklumkan bahawa daripada mereka yang telah mohon untuk home quarantine, 404 daripada mereka sedang menggunakan peranti digital yang sekarang ini masih dalam fasa perintis, pilot project. They are using the digital device, bracelet, that is being used to monitor the home quarantine. Once we've gone through the pilot process or pilot project and we are satisfied with the efficiency and accuracy of the digital quarantine device, we can roll out to more people who would like to home quarantine and use the digital quarantine device. Saya juga ingin bangkitkan satu lagi perkara yang penting, dan ini adalah berkaitan dengan usaha kita untuk mengurangkan jumlah BID ataupun brought in death. Ini adalah antara perkara yang akan kita memberi fokus yang segera. Selain daripada ujian yang perlu dibuat, selain daripada vaksinasi yang perlu diberi kepada semua pihak, antara perkara lain adalah kawalan kendiri juga. Kita dapati bahawa sebahagian daripada mereka yang dilapor sebagai brought in dead adalah mereka yang pada awalnya berada di dalam kategori 1-2, tetapi dalam tempoh masa yang singkat mereka telah masuk ke kategori 5, fast deterioration of their health condition. Sebab itu kita ingin umumkan bahawa kawalan kendiri perlu dilaksanakan, jalani pemeriksaan segera sekiranya mengalami kemerosotan gejala atau sebarang warning signs seperti berikut. Demam berpanjangan. These are for people who are positive, who are isolating at home, ya, tidak ada ada gejala yang ringan sahaja, tetapi tiba-tiba ada demam yang berpanjangan, kesukaran bernafas, sakit dada, tiada selera makan dan minum, kelesuan bertambah teruk, perubahan pada status mental seperti kurang tahap sedar dan confusion, kekeliruan, delirious, batuk, muntah dan cirit yang semakin teruk, kurang kencing, bibir atau jari kebiruan dan ketepuan oksigen saturation kurang daripada 95%. Mereka yang mengalami gejala ini dinasihatkan untuk menghubungi CAC dengan kadar segera ataupun talian 999 kecemasan, ya. Ini perkara yang perlu kita sampaikan kepada semua pihak, terutamanya ahli keluarga dan juga mereka sekarang ini yang didapati positif tetapi oleh kerana asymptomatic, tidak ada gejala, mereka isolate di rumah, tetapi bila ada escalation seperti mana yang saya sebutkan tadi, seek urgent medical treatment. Kepada yang lain, saya harap mereka yang mungkin tidak dapat dikesan melalui ujian, get tested if you have some symptoms and get vaccinated. Ini sangat penting. Soal BID ini akan kita sentuh dalam beberapa hari lagi nanti. Dari segi data, where are the BIDs coming from? Are they Malaysians? What age group? Comorbidities? Have they been vaccinated or not? We will release more data from time to time. Saya juga minta supaya amalan pemantauan kendiri di rumah melalui home assessment tool yang kita sediakan di dalam MySejahtera digunakan sebelum mendapat arahan selanjutnya daripada CAC. Ahli keluarga ataupun rakan serumah perlu prihatin dan peka terhadap keadaan dan kesihatan pesakit sepanjang pemantauan kuarantin. Buatlah video WhatsApp dan sebagainya kalau mereka isolate di bilik. Find out what is happening to them, ya. Sebab kita dapati bahawa dalam beberapa kes BID ini, deterioration dalam COVID ini berlaku dengan sangat cepat dan pantas, 24 jam sahaja. So those who are staying with people who are COVID positive, isolating in their room, check on them and check on their status and help them report on their status. Saya juga ambil maklum apa yang telah ada yang bertanya mengapa kes harian COVID-19 dan kes kematian masih tinggi sedangkan pada masa yang sama kadar liputan vaksinasi juga tinggi. Saya nak jelaskan bahawa peak telah dimulakan pada 24 Februari sebagai langkah untuk mengawal pandemik. Sehingga Hari Merdeka semalam, sebanyak 84.3% populasi dewasa telah menerima satu dos vaksin, manakala 64.2% populasi dewasa telah menerima dos lengkap, 2 dos ataupun dos lengkap daripada vaksin 1 dos. Kadar liputan imunisasi COVID bagi populasi dewasa yang telah mendapatkan sekurang-kurangnya 1 dos vaksin di beberapa negeri seperti Lembah Kelang, Negeri Sembilan, Sarawak dan wilayah Persekutuan Labuan telah melebihi 90%, manakala lebih 75% populasi dewasa telah menerima dos yang lengkap. Bagi negeri-negeri lain, aktiviti pemberian vaksin sedang dipertingkat dan kita menyasarkan sebanyak 80% daripada populasi dewasa akan menerima dos lengkap vaksin COVID-19 pada akhir Oktober. Peningkatan kes yang mendadak direkodkan bermula awal Julai, terutamanya di wilayah Persekutuan Labuan, Lembah Kelang dan Negeri Sembilan. Dan situasi ini selari dengan peningkatan kes jangkitan varian Delta di seluruh dunia, termasuk di Malaysia. Mengambil kira situasi ketika itu, kerajaan telah membuat keputusan untuk mempertingkatkan vaksinasi di negeri-negeri tersebut bagi mengurangkan kes jangkitan teruk dan kematian akibat COVID-19. Langkah di negeri seperti Lembah Kelang, Selangor, wilayah Kuala Lumpur, Labuan dan juga Negeri Sembilan telah menyaksikan pengurangan beban keupayaan ataupun telah menyaksikan satu kejayaan di mana keberkesanan vaksin ini dapat dibuktikan menerusi trend kemasukan pesakit dalam hospital di negeri-negeri dengan liputan penerima dos lengkap melebihi 50%, seperti Lembah Kelang, Negeri Sembilan dan wilayah Labuan dan Sarawak yang menunjukkan penurunan. Trend penurunan kemasukan pesakit COVID-19 juga dapat dilihat di Hospital Sungai Buloh, di mana penurunan sebanyak 53% berbanding pada awal bulan Ogos. Manakala bagi Hospital Tengku Ampuan Rahimah Kelang terdapat penurunan sebanyak 44% bermula awal Ogos selepas sebulan aktiviti operasi surge capacity di Lembah Kelang. Sehubungan dengan itu, saya ingin menjelaskan dan menegaskan bahawa vaksin COVID-19 yang digunakan dalam PIK adalah berkesan, terutamanya dalam mengurangkan risiko komplikasi jangkitan yang teruk. Daripada 16 Julai hingga 31 Ogos, sebanyak 865,472 kes COVID-19 dilaporkan. Daripada jumlah tersebut, 2.1% adalah dalam kategori klinikal 3 hingga 5, dan daripada kes tersebut sebanyak 10.4%, 1,894 sahaja mempunyai sejarah vaksinasi yang lengkap. So the vaccines are working. Even with the Delta variant, the vaccines are working. So somebody might ask me, for instance, what is happening in Sarawak. Sarawak has a high vaccination coverage, tetapi bilangannya masih lagi tinggi. Tapi mengikut data yang kita ada, 99% daripada jangkitan di Sarawak adalah kategori 1 dan 2. Masih lagi dalam keadaan terkawal dari segi kemasukan hospital dan sebagainya. Ini adalah juga seperti mana kita melihat di negara-negara maju yang lain, di mana walaupun mereka telah meliputi ataupun mencapai liputan vaksin yang tinggi, tetapi kes jangkitan harian mereka masih lagi ribuan. Contohnya di United Kingdom masih lagi 20,000, 30,000. Tetapi yang penting adalah soal kemasukan hospital, kematian, kemasukan ke unit rawatan rapi, penggunaan unit peralatan pernafasan. Itu yang perlu kita melihat. Jadi saya harap walaupun kita akan usaha, KKM akan usaha untuk menurunkan kes harian, insyaAllah, dengan vaksinasi, dengan langkah-langkah kesihatan awam yang lain, tetapi yang lebih penting adalah untuk fasa endemik ini kita mula melihat kepada angka kematian, kita mula melihat kepada angka kemasukan ke hospital, ke ICU, dan kita pastikan bahawa sistem kesihatan awam kita terutamanya tidak terbeban dengan gejala-gejala yang teruk daripada akibat COVID-19. Saya juga ingin memaklumkan tentang AEFI, ya. Sebelum saya buka kepada soalan, saya ingin memaklumkan bahawa kita telah pun melaksanakan pemantauan yang rapi terhadap kes-kes AEFI ataupun Adverse Event Following Immunization, untuk memastikan bahawa vaksin yang kita bagi ini adalah selamat dan tidak mengundang kemudaratan dari segi kesan sampingan yang serius. Saya ingin maklumkan bahawa from the start of the vaccine rollout sehinggalah 30 hari bulan Ogos, sebanyak 34.46 juta vaksin dos telah pun diberi, dan kita telah terima respons dalam MySejahtera, laporan kendiri, ya, 20.7 response for every 1,000 doses. It's quite high to give us some indication of the AEFIs. Jadi melalui sistem pelaporan AEFI ini, the rate of overall reporting received is 0.53 per 1,000 doses. 0.53 adverse events following immunization per 1,000 doses. Tapi saya ingin juga maklumkan bahawa daripada jumlah ini 0.04 daripada 1,000 dos dilaporkan sebagai serious AEFI. Only 0.04 from 1,000 doses have been reported as serious AEFIs, and a majority of these serious cases have only required a short period of hospitalization or observation and treatment. Sehingga hari ini saya ingin menegaskan bahawa tidak ada satu pun kes kematian yang telah menunjukkan causal link ataupun kaitan langsung dengan vaksinasi. Tetapi untuk melegakan hati rakyat kita, saya dah bincang dengan Tan Sri KP, we will release a huge amount of data on AFIs by next week, so that you can see exactly what kind of AFIs, sama ada headache, fever dan sebagainya, and also thromboembolic events. Ya, jadi kita akan release as part of my commitment to provide more transparency to you by next week on the AFI numbers. Saya buka kepada soalan.
Hi YB, congratulations on your appointment. Prem from Nikkei here. YB, I have two questions for you. One is, since we are talking about endemic now, are we prepared for a booster shot, or are we even discussing about booster shots? And Pfizer has announced yesterday that vaccine for children between 5 to 11 years old will be ready by year end. Are we already discussing about it, and are we ready to procure once it's ready? Thank you.
On the question of booster shots, we've had a discussion. There's an expert working committee that has been set up to provide recommendations for the booster shots, at what interval, whether or not it is homologous or heterologous booster shots, same or different vaccine. We hope to have recommendations by the end of this month for us to announce what the policy will be for booster shots. For now, we are quite satisfied that we just proceed with the existing pick. The priority now is to provide vaccination for those who have not been vaccinated yet. Yeah, and then we will talk about booster shots once we get the recommendations at the end of this month. As far as vaccinations for children are concerned, as far as the adolescents, the circular has been issued by a DG circular on the policy for 12 to 17-year-olds. We are just waiting to execute on the vaccination for adolescents, because we want to again prioritize the adult vaccination first. Once that's reached adequate level, then we will commence vaccinations for teenagers based on the priority groups that have been identified under the circular issued by the DG. And I hope that we can start doing that by sometime this month, hopefully, based on vaccine supply. On vaccinations for pediatric vaccinations, those under the age of 12 years old, there has been no approval for pediatric vaccinations yet in Malaysia or anywhere else. They're still under review by the regulatory agencies, sama ada FDA, MHRA, or even here in Malaysia. Once there's enough data to support that it is safe for us to give it to children, then we will take that to the vaccination committee for consideration and for us to decide. But however, I would like to inform that in my negotiations with Pfizer have informed us that they may be coming up with a specific vaccine that will be used for children. And this vaccine will have different dosage levels than the present vaccine given to adults and adolescents. So we are still in negotiations with Pfizer, trying to get the requisite clinical data from Pfizer to see that the vaccine is safe and to see that the vaccine is efficacious. For now, we have not yet decided to go ahead with vaccines for children. I want to give some reassurance to parents that in lieu of the fact that we cannot give vaccinations to those who are under 12, we are doing our best to make sure that teachers are vaccinated. We're doing our best to make sure that people who are working in schools, the clerical staff, the canteen staff, the janitorial staff, the security guards, as well as the bus drivers are vaccinated, so that the environment is vaccinated. Sukacita saya maklumkan bahawa mengikut angka yang terkini, daripada jumlah guru seramai 412,000 yang ada di Malaysia, 96.5% telah menerima sekurang-kurangnya 1 dos, manakala 83.5% telah lengkap menerima 2 dos. Manakala bagi pekerja sokongan di sekolah-sekolah, 84.8% telah menerima 1 dos, at least 1 dos, dan 68.8% telah lengkap menerima 2 dos. So we're trying to make the schools as safe as possible for children who cannot be vaccinated. And then of course for the adolescents, kita akan mula dengan exam going age, 16, 17, and then we will de-escalate the age after that. Yeah. So hopefully we get as many children, as many teachers, 100% kalau boleh. Kita nak 100% teachers vaccinated. There are some teachers who are not wanting to be vaccinated, anti-vax. Saya akan minta mereka jumpa dengan Rumah Kota Johor.
YB, Alifa from Code Blue. I have a couple of questions. YB, earlier you mentioned about prioritizing some states for vaccination. So do you have any priority for testing? Since most states recorded average positive rates above 10% and the past epidemic week, and a couple of other states recorded above 20% positive rates. Second question is, there have been about 68,000 breakthrough infections reported in fully vaccinated people from August 12 to 29th. So can we know what the proportion of vaccine brands that were used among them, and the interval between last jab infection and profile of these breakthrough cases like age and comorbidities?
The second question was on breakthrough infections.
Correct, yes.
Okay, yeah. So we will of course prioritize testing for states that are showing a high positivity rate right now, and also a relatively low vaccine coverage. And these are the states that I mentioned: Perak, Terengganu, Johor, Kedah, Kelantan and Sabah. That's why there's a sense of urgency for testing and vaccination in these states, as well as some other measures that we have implemented in the Greater Klang Valley Task Force. But be that as it may, it does not mean that we will reduce our testing capacity in other states. Yeah, because most states are still having a positivity rate of more than 10%. Okay? Most states more than 10%. So we have always emphasized on testing, but we want to do testing in a targeted manner. We repeated this again and again and again, so that we make the best yield from the resources that are available. We are also working together with the private sector. We are trying to encourage companies to come forward and test their employers. We cannot rely 100% on government testing. This is where employers, if they want to start opening up their businesses, they have to step forward to provide testing for their employees, especially those who are symptomatic, those who are sick. They must do that. Saya juga ingin memaklumkan bahawa ada berita baik hari ini, mana saya akan minta Menteri Perdagangan Dalam Negeri dan Hal Ehwal Pengguna Umum dalam masa yang terdekat. We have set a ceiling price for rapid test kits. We have decided in Cabinet today to set the ceiling price. The ceiling price has been set, and Dr. Sri Alex Linggi will be announcing that very shortly. Oh, sorry. On the granular detail on breakthrough infections, we'll provide that to you in writing. Yep.
Harith Muhammad from Malaysia Kini. I have two questions. One is, when do you expect that this endemic phase we can start, to the new norm with the endemic phase? You mentioned about schools. Most of the teachers have been vaccinated, and the staff. How about the teachers and staff who are not vaccinated? How about teachers and staff, school staff who are not vaccinated? Would they be allowed to work since the children cannot be vaccinated? Third question, but this one you can answer later, because this is related to the cases in Johor and Kedah, where patients, COVID-19 patients, were allegedly neglected, that led to the death in Kedah, and the woman who had to give birth alone in Johor. Thank you.
So for the cases in Johor and Kedah, there have been statements that have been issued by the state health directors, but we are looking into the cases. I believe the Kedah case has been a police report has been done already. So we allow the police to investigate, and we will cooperate with the police. We will also have to study if there are any medical legal issues in any of the two cases, and our medical legal department is looking at that right now. On teachers who do not want to be vaccinated. Now, this is a big question. It's not just the school sector, but it's also people who are working in industry. What if they refuse to be vaccinated? For the time being, the government has still maintained that we are not going to mandate legally vaccines as mandatory. We are going to encourage, we are going to provide privileges for people who have been vaccinated to do things that people who have not been vaccinated can do. But we also encourage sectoral persuasion. Sectoral persuasion is not law. It's not a federal mandate. But if a particular company says, if you want to come for a meeting, if you want to come for to work, you have to be vaccinated, then that's up to that company. And if schools decide to encourage it or decide to persuade teachers to do it, then that must be the case. But what I want to do is I want to discuss with my team at MOH, in the event that there are still people who refuse to be vaccinated, and not on medical grounds, but because they don't want to, by choice, become vaccinated, and we refuse or we do not go for a federal mandate by law, we don't go all the way, what are our options? So some of the things that we're looking at is a national testing strategy, a national testing policy after this. Once we go in endemic, whether you've been vaccinated or not, you need to test yourself quite regularly. Yeah, and that's why we want to make testing more affordable and more accessible. So those who refuse to vaccinate will have to have a certain schedule and regime of testing that they will have to adhere to. Whether it is rapid test kits, and if that's positive, they have to confirm it through a PCR test. So we will come up with a policy, a national testing policy, to hopefully take into account those who refuse to be vaccinated. But my preferred outcome is that if you have for no medical reason, any reason, not to be vaccinated, go and get vaccinated. Yeah? I've not come to the stage where I'll recommend to the cabinet a federal mandate, but I'm not far from it either. Yeah? What was the other question? So the pandemic phase, we will wait for the next 2 months. We want the 80% end of October to come. But I think if you look at the case of Labuan, even to a lesser extent Sarawak, they are already in that endemic phase. So I can say that by the end of October, we will reach that sort of endemic cutoff point where we have to start looking at living with the virus. We are already living with it, but in some states we are still in mitigation / late containment. But now I think by the end of October, it's about living with it.
Hi, YB. Congrats on your appointment. YB, just 2 questions. First question will be, the PM announced a 6 million additional vaccine dosage. You have previously said that we have enough for 130% of the population. And this 6 million, where it's going to go and what vaccine it's going to be? And the second question is that you have stated that there will be privileges for those who are vaccinated. But for some cases, for those who are not vaccinated for medical reason, and those who have already completed 1 dosage, and then they could not pursue the second one due to medical reason, what will be done to them? Because for nowadays, they are not being allowed to enter into some premises and all these things. Just these 2 questions.
So I'll take the second question first. As long as they have a doctor's confirmation that they cannot complete their vaccination, or on medical grounds they cannot be vaccinated, we will come up with a feature on MySejahtera to show that you are somebody who on medical grounds cannot be vaccinated, and therefore we will come up with SOPs that are appropriate for those people. But there will be a feature in MySejahtera to show that this person cannot be vaccinated on medical grounds. Yeah, that's one. Secondly, on the 6 million additional doses, of course KKM and also JKJAV thanks the Prime Minister for the very important announcement to announce this buffer supply stock. So for the time being, we will consider when to exercise that, now that we know that the allocation is there. At the moment, our vaccine schedule for September seems to be quite adequate. But if there are any shortages and if there are any disruptions to the supply, then we will exercise the option that Prime Minister has announced. For the month of September, we will be allocating to the states 15.5 million doses of vaccines. And the states that will be receiving the most vaccines will be Johor 1.9 million, Kedah 1.3 million, Kelantan 1.2 million, Pahang 1.4 million, Perak 1.6 million, Penang 1 million, and Sabah 2.9 million. This is to allow for the states to catch up this month.
YB, Rafida dari Tarian.
Yeah, 2 more questions, Maya? Yeah?
Okay. Tadi YB disebut pasal
Rafida, where are you?
Tadi YB ada sebut pasal penugasan semula di kawasan-kawasan yang low vaccination rate kan. Jadi berapa banyak petugas yang akan deploy ke kawasan-kawasan di luar Lembah Kerang selepas ni? Dan adakah peralatan-peralatan, berapa banyak peralatan juga yang akan deploy?
Kita akan memberi butiran detail kita. Last question. Yeah.
Yeah, my question is, Delta has already become the main variant here. So could you introduce the differences of the pandemic situation compared to previous, especially the capacity of a hospital, the medicine supply, and also the vaccine supply? I heard that it has some vaccine supply be postponed. And also Bloomberg recently commented Malaysia is bottom in the list of the 53 countries in the containment of pandemic. So what do you think of this?
What 53 countries?
Yeah, my second question is about Bloomberg
okay.
assess.
So on capacity, we will be releasing a lot of details on hospital capacity by state, including ICU capacity by next week. We are getting all the data ready so that I can release it in a transparent manner, so you can have a look at that. On the vaccines, most of our vaccines have been sent on time. We've of course experienced delays here and there. That's normal because this is a global supply chain that is highly competitive. Every country wants vaccines, but we have enough right now. On the Malaysia's rank in the COVID resiliency index and all these indexes, it's a snapshot in time. At one point, Malaysia was top 10 in the world. And then at one point, Singapore was lower than us. Now it's the other way around. It's how we emerge from this that matters. So I think each country will see ebbs and flows in its success in dealing with COVID. But I'm quite positive, cautiously optimistic. We hope, pray to God, that the next 2 months we will see light at the end of the tunnel. Thank you, everyone. Thank you.